Hello, I'm Tara. Welcome to my channel. Thank you so much for choosing to watch my video today. And I just want to get quickly into the video today. As you can see by the title, it's actually a very strong question of whether or not we should take meds for our mental illnesses, mental disorders. And before anybody here gets annoyed and thinks, who the hell is this girl to make a video about this? I just want to do a quick disclaimer. First of all, the only reason I'm even doing this video is because somebody asked me the question about medication in one of my other videos where I talked about my mental health breakdown, basically. And somebody asked me the question in there about medication. And I really could have just answered this as normal in the comments. However, I feel like this is one of those questions that's quite nuanced. And the more I was typing, the more I was like, there is no way I can properly answer this question in the way I want to answer it if I just write it. And I thought, the fact that one person is asking this question probably means that there's other people who still don't really know, or maybe are doing their research, seeing what other people did in regards to taking medication. And I just wanted to give, like I said, my point of view in regards to that, but with a little bit more nuance, because the answer to this question is not yes or no. And it will never be just yes or no, because it highly depends on who is asking the question. It depends on their circumstances. It depends on a whole bunch of factors that I couldn't even begin to talk about in a video. So let's get that out of the way straight away and say the answer to this question is neither yes nor no. It's fully dependent on who is asking the question. Second of all, asking somebody else, of course you should do that, because it's a great way, one, of having the stigma taken away from it, and two, that's how we learn about things. That's how we find out things. We ask other people and we ask about their experiences. But the one thing to remember is chemically we're all really not the same, especially when it comes to our hormones, and it comes to our serotonin levels, and it comes to our dopamine levels, and it comes to all of these other levels that play a big part into the mental disorders that we do suffer with. There's so many things that play a part in that yes, you can ask me the question and I could have had an amazing experience with a particular medication, and then you could take that exact same medication and have a horrible experience. So it's really hard, actually, to answer the question in a way that isn't influencing somebody when you tell them about a particularly good experience, perhaps, that you had with the medication. Which is why, again, like I said, when I was answering to this comment, it just kept getting longer and longer and longer until I realized that there's literally no way I can just write the answer down, just because it would be irresponsible of anybody talking about this subject to, I don't know, to give you some type of definitive answer, or to give you some type of answer without the extra explanations around it. This is obviously assuming a lot of different levels of knowledge and understanding around this subject for those that are watching, and even for the person that asked me the question. I don't know whether or not they'll be at their first stage of literally like doing research into this and finding things out, so they literally don't know anything about the meds at all, or if they're on the other side and they're an expert at this now and they understand all of the nuance and stuff like that. That's why, like I said, it's responsible to, of course, answer the question when you're asked, but unless you know that person well, make sure that you're giving the full nuance. So for me, anyway, just because I'm sure a lot of people are wondering, for me, it was buspirone that I was prescribed, and this is an anxiety medication. My diagnosis is generalized anxiety disorder. And buspirone for me worked to take the edge off. As in, obviously, it took a few weeks for it to actually be in my system and do what it needed to do. So this is the other thing, actually, when it comes to medication that I always struggle with is knowing whether or not something has worked because it has worked, or if enough time has gone by that perhaps your symptoms or whatever were lessening anyway, but who knows, right? Because I was doing therapy as well at the same time. I was getting CBT, cognitive behavioral therapy, for those of you that don't know what CBT is. So I had a combination of a few things that I was doing. But for me, anyway, like I said, I'd never taken medication before for anxiety. This was the first one, but buspirone was the one that I took, and I do think it took the edge off after a few weeks. I also ended up weaning myself off buspirone because I have my own ways, which I will not get into in this video because it's not really to do with that at all. But it's just to say whether or not you should take medication is something that you need to decide for yourself, and not really something you should be looking too much for opinions from other people except your doctor. Like, it really should be a you and your doctor thing. And I would always recommend going with the advice of a doctor who's gone to school for this and hopefully knows what they're doing, because doctors are still humans. And also there'll probably be a lot of trial and error. I've heard with some things where you may need different combinations. This particular one may have too high levels of this thing that just doesn't react well with you. There's a number of different things that could happen, but this journey should be a journey that's advised by your doctor. And the decision should be yours, really, only. But I would say, go with the experts. Whoever the experts are that you're speaking to, go with the experts, go with the people that know exactly what they're talking about. And of course, keep discussing this, keep talking about this. I'm so grateful for the person that asked me this question, because I want to talk more about mental health on this channel. And really, the stigma needs to get away from it, because I'm one of those people with mental health, like I said, the generalized anxiety disorder, and I'm neurodivergent. For me, these two things are separate. I know some people may disagree with this. It's a topic I'm also very much happy to have. Like I said, I want to talk more about stuff like this because genuinely, I always assume that a lot of people now are aware and they know all the things about mental health that there is to know now, where to go look for this, how to begin the process of, looking for therapy or doing all of that. But it seems like there's actually a lot of people that still don't, a lot of people that still are also learning and coming up. So there's a lot of awareness that's still needed. And yeah, your girl is more than happy to add a voice to that. But yes, thank you so much for watching this video. I hope it was helpful for anybody watching. And just one last thing, actually, before I sign out completely. If you are somebody that's, suffering from a mental health disorder, do know that it's very normal. Like, a lot of people have different things that they have to go through that are in different degrees and different levels and different whatevers. But just know that it's normal. And it's normal because it's clearly something that happens to human beings, and you are a human being and it's affected you. So you're normal. It happens to millions of people. You're not alone. You're not alone. Like, ever, you're not alone. There's always going to be somebody, especially if you're on the internet and you're watching this, it means you have access to the internet, which means you have access to people, a community of people that will always be there to talk to you, there to be whatever. I'm here, by the way. I don't want to just speak to other people. In my comments, like I said, this video was literally triggered by somebody asking a question in my previous video about this. So please ask any questions that you have. I'm happy to share my experiences. And yeah, please keep strong, and you're loved, you're worthy. And yeah, if you love this video, loved it. If you liked this video, please like the video. Please subscribe to my channel. Press the notification bell because I will be posting more on here. And yes, love, light, and looking after your mental health. Love you. Bye.